Hi, my name is Jackie Alvarez, and I'm going to be presenting on the ethical considerations surrounding the withdrawal of ventilators from COVID-19 patients. And my presentation is going to be broken down into two parts. So I'm going to start with the recommendation on how to approach these decisions, and then I'm going to go into the argument supporting the ethical basis for such actions. So starting with my first recommendation, it's going to be centered around the importance of a patient's autonomy. So if patient has clearly stated or expressed their wishes through advance directives or through conversations with their healthcare providers which indicate that they prefer to withdraw from a ventilator support under certain circumstances or conditions, these preferences should be honored. And in these cases, the ventilator should be relocated to a patient who has a higher probability of recovery. And using this approach would ensure that the patient's autonomy is both respected and that life-sustaining resources are being utilized where they have the greatest potential for benefits. And in further recommendation, I believe that these decisions regarding the withdrawal of ventilators should be made on a case-by-case basis. So considering things like a patient's age, underlying health conditions, and the overall prognosis, these factors should all be a guide for these decisions. So for example, younger patients generally have a better chance of recovery compared to older patients, particularly those over the age of 65. So prioritizing ventilator support for patients with a higher likelihood of recovery is both ethically and medically sound. So now going into the argument, I'm going to be supporting the ethical decision to withdraw ventilators from COVID-19 patients. So the key ethical principles here is the balance between beneficence and non-maleficence, which is the doing good while avoiding harm. So if continuing a ventilator support means it only prolongs life without realistic chance of recovery, then it is ethically justifiable to withdraw the support. So this would allow the ventilator to be used with another patient who may have a better chance of benefiting from it. Moreover, this family involvement is an important component for this argument, particularly cases that involve older patients, because families often struggle with the decision to withdraw from life-sustaining treatment. So healthcare providers must engage with these families using compassionate, clear, and honest discussions about the patient's prognosis and the likely outcomes of continued treatment. So when it becomes evident that a ventilator support will not lead to recovery, then the ethical course of action is to transition the patient into a palliative or hospice care. And this approach provides the patient with dignity at the end of life while allowing scarce resources to be relocated to others in need. So in conclusion, the recommendation to withdraw ventilators from COVID-19 patients should be guided by respect for patients' autonomy and careful case-by-case assessments. And the argument in support of this recommendation is rooted in the ethical principles emphasizing the need to use life-sustaining resources where they can offer the greatest benefit, while also providing compassionate care for patients and their families. And the resources that I used are from the Principles of Biomedical Ethics from Oxford University Press, and from the Bioethics Principles, Issues and Cases, 5th edition, Oxford University Press. And that is all for my presentation. Thank you.